In today's video, we will compare the healthcare system in the United Kingdom and the healthcare system in India. Every human being in the world requires healthcare, and every country in the world provides healthcare to its citizens in its own manner. There are differences in the way healthcare is provided to different citizens of different countries, but the goal remains the same. The strategies are different, and each strategy has its own advantages and disadvantages. In this video, we will compare the healthcare system in the United Kingdom with that in India without trying to judge which one is better. We will just highlight the differences in the method that is employed by these two countries. In the United Kingdom, there is something known as the NHS, or the National Health Service, which is basically a team of doctors employed by the government to provide healthcare to every citizen of the United Kingdom. It is built on taxes, and everyone in the UK, whether rich or poor, regardless of their ability to pay, gets healthcare. But how does the NHS itself get the money to provide healthcare? It is through general taxation. So the money that the citizens of UK pay in taxes, or the people living in the UK pay in taxes, that funds the healthcare that the NHS provides, from minor checkups to big operations. So it's general taxation that covers National Health Service. In India, healthcare service is divided into the public sector and the private sector. There are big government hospitals, government schemes that ensure that people in India receive healthcare, and there are also private clinics and private hospitals, especially in big Indian cities, with specialized doctors who also provide healthcare for a cost. Now, in the private sector, maybe the wait time is less, but the cost is higher, and in the government sector, the wait time is higher and the cost is minimal. So this is a kind of a puzzle which some Indians do find difficult to navigate, and it is a cause for concern in some instances, especially when affordability becomes an issue. However, due to the vast population in India, a mix of public and private healthcare is required. So when it comes to the NHS, the best thing is that everyone is covered. Everybody in the under the ambit of the NHS gets healthcare, regardless of the ability to pay. Whereas in India, there is a mix of public and private healthcare, so that whichever kind of healthcare a particular person needs, they can go for it. The element of choice exists in India, whereas the fear of going bankrupt while seeking healthcare does not exist in the NHS.